Two, we can't force people to be vaccinated. Let's dialogue with them. Let's tell them the dangers and the concomitant effect of not being vaccinated. And somebody was asking me, sir, if after the vaccination I'll still have to be wearing my nose mask around, then what is the essence of being vaccinated? Because there are a lot of theories about this whole thing, blah, blah, blah. But
so Dr. Michael, take note of that. People are still wondering, why should I take the vaccine and still follow the safety protocols?
Yes.
So you respond to that for us, Dr. Michael Usu.
Yes, David, then finally, I think there should be something like a date, like when you come to vaccinated, they'll give you something, some 50 cities. And I believe that will push the people. Oh, yes.
Thanks, Christophe. You're talking about incentives. In South Africa, a similar thing is happening where Henry Rand also is giving. Thanks, Christophe, for joining us. Lawrence, good morning. Hello, Lawrence.
Good morning, Dave.
Yes, Lawrence, good morning and welcome, sir.
Thank you very much. Dave, we heard Dr. Akuetteh talk about government workers, police security. What of the population in the markets?
He mentioned that as well. He mentioned that they're going to the markets. Yes, he mentioned that. And somebody was wondering, how about funeral grounds?
Yes. I didn't hear about the market. That is my main concern.
But he mentioned the markets.
Oh, okay.
He mentioned the markets. Okay. Lawrence, thank you very much for joining us. 03220-83596 is the number to call us on. We're talking about new measures that government intends to introduce or to roll out to help us win the battle against COVID-19. There's a new variant in some countries. It's called the Omicron. We're hoping it doesn't get here, but Dr. Michael Usu says, well, you cannot really guarantee it. It will definitely come in at one point in time, but how you manage it to make sure it doesn't get out of hand is what really matters. Peter, good morning.
Good morning, David.
And welcome, Peter.
And good morning to all your listeners. Please, I wanted to know from Dr. Usu that those who had already been infected with the virus, do they have some form of immunity against the virus?
So, Peter, he's going to answer that question for you, okay?
And also, if they have some immunity, then since the vaccines are in short supply, why don't we test that form of immunity? Then we can do the vaccination for those who are yet to be infected.
All right, Peter, thanks for joining us. You're talking about immunity once you have gotten the infection before. 03220-83596. You can also join us. We're having this conversation on new measures that are being rolled out to help fight the COVID-19. Join us on 03220-83596. Michael, good morning.
Good morning, Dave.
Welcome, sir.
Great. You know, honestly speaking, I've been championing and advocating that people should be taking the vaccine.
Okay.
But taking the vaccines alone can't prevent the viral infection. You know, most people are very reluctant, relying on the vaccine or taking the vaccine so that I can live any opulent lifestyle. I can eat anything that I want. I will engage myself in unhealthy lifestyle. You know, one thing that I'll urge our medical practitioners, I'm also in the field, I'll urge them, they should start advocating. As we have channeled most of the energy on advising people to be taking their vaccine, that people should start living a healthy lifestyle, being physically active, engaging yourself in exercise, eating well, avoiding stress. All these aspects will help boost people's immunity rather than always rely on the vaccines alone.
I hear you. Well, thank you very much, sir. And that's why we're encouraged to continue observing the safety protocols, as is still very, very essential. And I like what you said, Michael. No wonder you happen to be in the health sector. 03220-83596. David. Good morning.
Good morning. How are you?
I'm well. Let's hear you, sir.
Good. David, what about this, our local organic vaccine that people made videos of it, put it on the platforms, social media. I'm talking about this, our ginger, our hintia, our pepper.
The neem tree, and all those things.
Exactly. When we were at the peak of this variant or whatever it is, and people were doing these things, and there were testimonies that they were being healed. Why can't we also, how do I even put it? these local vaccines. Let me put it that way, doctor, so that we also do it here to boost our immunity.
So, the question is: have we researched into it to ascertain for ourselves whether indeed it works?
We should also research into it. Let our people, let us find and boost their morale to research into it and give it to us. And let us also take, because that's what some of us relied on. I remember last year.
I hear you. And David, you know what? Because of you today, I'm going to have a very fat lunch because today is one of the days you've spoken well for Ghana. Thank you very much, David, for joining us. All right, my brother. Nana Kweku joins us next. Nana, good morning.
Good morning, Manchester.
Adromoso.
I don't understand something. And I don't know if the NC is working or not. The reason why I'm asking this question is that there are certain people, pastors who are going on radio stations advocating that the
vaccine
is not good, blah, 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 something. In fact, I don't want to repeat it. And the whole thing is that they are inciting others not to take the vaccine. And I wonder why the NC is there. And in fact, as of for the party, are you more Christian than the Pope? Yeah, whoa, what a Bible, yeah, Bible, the Bible prayer in Ghana. Are we more holier than the Pope? And then sits down, and then people advocating that people shouldn't be taking the drugs. And in fact, I ask such people, the same killer diseases that you allow your kids to be taking, is it not the same vaccines, polio, and those kind of things? And please, this vaccine is there. People have been asking, why if I take it, why is it that it doesn't, I don't get something like immunized or something against it for future occurrence. Please, go to abroad. Cold, go to abroad. Every year, they take it. Immunization against cold vaccines, they take it every year. And it does happen every year because in winter, it does happen. So if we are being asked to take and protect ourselves, why do we have to be using Christianity, certain things to, please, the vaccine? Everyone should go for it. Well, I also advocate, much as we are saying everyone should go for it and advising it, they shouldn't let it be something like by force. They shouldn't enforce it because in America right now, I don't want to put it there because you've got to tend to talk about it. But please, everyone should go for the vaccine.
I hear you. Nana Kweku, thanks for joining us. And we're